Hello and welcome to the Victress Podcast. I'm Dr. Elisa Marino and joined by Aaron Hazelbaker. And today we're excited to have another guest on the show. Kevin Platfoot is president of Buckeye Electrical Products. And before I bring him on, basically I want to not only hear the story behind the success of your team and the business, but mostly why you made this choice to dive into an innovative health plan, right? So, we're healthcare professionals, right? We just want to see our patients, and we want to see healthcare providers, thriving and work on that side of things. But really, when it comes down to it, we have to address that statistic of 50% of Americans are now diabetic or pre-diabetic. 30% of children are now diabetic or pre-diabetic, right? And so in order for us to do that, the majority of Americans have a health plan through their employer, right? And so if they don't have access to high quality health care, then how are we going to be reaching them? And so it comes on the responsibility currently that the employer would help them with that. And so right now where we're at, health plans are the number one driver of bankruptcy, debt, inflation in America. And so we have to continue down that chain to the root of the problem. And so that's why we brought in Kevin today to explain what that process was like. I always love a good story. And so, we're going to get to that. What were the nuts and bolts of that, of how you guys decided to do that, why we had to, you guys had to do something different and really, stop just accepting the status quo. But first I want to hear your company story, because I think it's awesome. And it sounded like it all started out of a goat barn, or no, the basement and then the goat barn.
Yeah. So my dad founded the company, Dick Platfoot, in about 1995. Started in the basement, and he was still working full time then, and eventually moved into the goat barn that he had kind of refinished and repurposed. Did that for several years, and then put on a pole barn extension on that barn, and then so that lasted until 2012, and then started building out here, and moved in out here in 2013.
That's awesome. So yeah, we're in Botkins, Ohio. So pull out your maps and just look about, let's see, what are we, about 50, 60 miles north of Dayton on 75. So yeah, right up that way. Yeah.
Yeah. And so now you were telling me a little bit about kind of that succession plan. You have two, I guess, of your 9 siblings.
Yep.
Correct.
9
right?
kids. Yep.
That are in the business.
Yes.
In the day to day. What was that process like?
It was really kind of one at a time. When I got out of high school, I was in the military, went to college at Wright State, and started out living in Dayton, and just took work to my apartment as just like a job, college money type of a thing. And so I did that for 2 years, and because I was in the military, I was older than everybody else who was there. And so by the time I hit my junior year, I decided to move back to Botkins and work at Buckeye and commute to school because I could get more hours. I was very adamant that I'm not coming back. This is not for me. I don't want to do this. I'm just here to get the hours. I just need the money and then, commute to college. So did that for the last couple of years, and somewhere along the way just fell in love with the process of running and growing a business. I want to say my senior year, I was probably working about 60 hours a week, commuting to Dayton, and I stacked all my classes 2 days a week. So it was like, long days, those 2 days, just trying to make the most of the day. And so I did that for quite a while. It was me and my dad, running the business, and eventually my sister Kim joined us, and she was formerly a math teacher. And we were looking for somebody to kind of run the office, and so thankfully she took on that role and did a great job with it. Like I was joking with you, I told her that if you can do math, I promise you can do accounting. It's all numbers, and you're going to do great with it, and she has. So my sister Kim is here now, and she kind of, like I said, runs the office and all the accounting and all that stuff that goes with that, which is a huge help. And then I think it was about 2 years ago, my younger brother came back full time. Like most of us, he worked here, throughout school and stuff. And he managed our IT stuff while he was in college. That was kind of his part-time gig when he was in school. But came back full time a couple years ago, and he is an electrical engineer. So his job is pretty obvious. He's in charge of all the engineering, which also spills over into quality, and he still does the IT stuff. So we all wear a lot of hats. We all kind of have our own sectors of the business that we actively manage, but then, at the end of the day, when it's policy change, when it's handbook updates, we all kind of reconvene and make those decisions together. So it works out really well.
I think that's a good segue. You all wear a lot of hats. We all understand that in small business.
Yep.
It doesn't matter if you've got 200 people or 50 or 10 or 5 people, you're always wearing a lot of hats and always constantly learning how to delegate and give away control and all of that. But so, when you talk about trying to understand benefits and healthcare and, where does that fit into the picture of like wearing a lot of hats and something that's kind of, could I say, necessary evil sometimes?
Absolutely. Yeah. That was something that, when we started out, we had 0 benefits. It was an hourly rate and that was it. We had no benefits whatsoever. And that was kind of part of the growing pains was, let's start with something, let's pick something. And so I want to say before we even had like health insurance, we had kind of like a supplemental plan only type of a thing that we, contributed to. So we had that and, eventually worked into PTO and, vacation time and health insurance and eventually hit that 50, full-time equivalent threshold. And it was something we wanted to do anyways. I mean, the reality is that if you want to attract a really broad span of good associates, you got to have full benefits because so many other people have them, and that's something we want to be able to offer, and I feel like it's necessary for retention,
Man, that's something that we hear so often. I don't mean to cut you off, Kevin. I just think that you're speaking to just about every business owner that we speak to in Shelby County right now. Is just that is their main focus is I have to be able to retain my people. I've got to make sure that I've got quality benefits so that I can retain, because we want to make sure that we're retaining these good people, that we have, and then attracting more as we're growing too, right?
So what was it like then adding that in initially?
It was painful, I mean, we're a family company. We started, again from a goat barn, So just in general, adding benefits was a painful process, especially starting from scratch, knowing where we had to get to with, the health insurance and all that. But like I said, we did them one at a time, and we were, I think, pretty transparent that we had to do them one at a time. And at times we even put out surveys like, okay, which one, like rank these, what's most important to you, base pay, health insurance, whatever. But it took several years of, just being able to consume some of that extra expense. To be able to
what about it was painful specifically?
Especially the health insurance part of it, right? Because I know that's the part that usually is the biggest kick in the pants when you're looking at this as a business owner.
Yeah. I would say specifically the expense. I mean, there's always the hassle of, every time you add something, it's one more thing to manage and track and report on and all that. But, for us, we were still in a growth phase where we were still working on getting more consistent business, and a lot of our orders were very, spotty. It was just whatever scrap you could pick up. So part of my concern was just making sure that we had that consistent flow of business to be able to support something like that, because that's an expense that you can count on, whatever it is, every week or every month.
Absolutely. Yeah.
And so what did you start with? Just some sort of traditional plan? Did you have a broker that was helping you, or how did you start that process then?
Yeah, when we first offered health insurance, we went through just a traditional provider, whatever you might call it, and that was really new to me, because personally, before we did that, I had never personally had like my own health insurance plan. I went from being on my parents', I was in the military for a little bit, so it was covered there. And then after that, when Buckeye didn't offer it, I was on like a Christian-based health share plan,
Sure.
which was much more affordable for a 24-year-old guy who never went to the doctor.
Right. So you were even using a health share at that point, not even
Yes.
using the company plan.
Yes.
And at that point, knowing that there's
Well,
something.
yeah. And I was using that prior to us offering any
Sure.
plan. But then once we offered that plan, I was like, this still can't beat the private health share.
Right.
Yeah.
Right. Yeah.
To stay on that.
I know. I love hearing you kind of speak to that too, because when he's talking about, just for everybody who's, kind of wondering, when he's talking about like a traditional plan, he's talking about your big insurance. So you're talking about, your UHC, your Anthem, those bigger names that we're all kind of aware of. And what's so fascinating is you've always been in that model. You don't know that there's something else out there. And it's so funny. You're coming the opposite, right?
Yeah.
So you did have some, government, assistance when you're in the military, et cetera, but then you chose to do that health sharing ministry. So you have a different perspective, which is probably why you were able to kind of start thinking a little bit different about healthcare. Tell us what really blew it up for you guys.
I mean, for me personally, I felt like I did have kind of a unique perspective because I never had health insurance personally. So when we started talking about these plans, I was like, what is this? Like, this can't be right. Like, the premiums with the deductibles, like, how can this be, And I think also for me personally, with the health share plan that we had, it was a health share plan, but it was very clear you're still responsible for your bill. So it was more of a reimbursement system, which meant, for years, and we had our first couple kids using this plan, you are directly calling these healthcare providers and negotiating, which I found out that whenever you visit a doctor, you get the doctor bill plus the hospital bill plus the
Absolutely.
anesthesiologist,
Yeah.
and there's like 6 different bills. But one of the things that just, I took away from that is I could not believe the kinds of discounts they would offer just by asking and
Yep.
just by offering to give him my credit card, just a self-pay, cash pay. I felt like 25% was pretty common. I had some of them that just by calling and saying, hey, I don't have insurance, can I just pay you? I had some of them give me a 50% discount.
Yeah, sure.
And I'm like, what business model can offer that sort of discount? And I'm sure they're still making money. This
Yeah.
is just insane.
Healthcare is still the fastest growing industry
right
in the country. It's not
Right.
tech, it's not AI. It's still so yes, they've
Yeah.
already built that in, but
Yeah.
from your perspective, you're seeing that as a patient, like where's that money going and how can I just take that off? And then but now you have a health plan that you're funding through the company.
Yes. Yep.
So what led you then to think differently other than me knocking on your doors?
Well, a couple different things. The plans that we had, no one was ever extremely happy with them.
They never are. I know.
There's no such thing as
Yeah.
a great health plan if it isn't free,
Yeah.
And I felt like we did have the high deductibles, high premiums, all that stuff. And just me personally, and I would venture out to say my family as well, we kind of view things through the same lens as far as the holistic approach. We try to not go straight to medicating problems away and, stuff like that, and focusing on kind of that proactive health. So I think when we first chatted, I was really intrigued. And I think the first time that we talked, I was like, I kind of shared with you, I was like, I've been feeling like this for a long time, like especially with COVID. There were so many great healthcare professionals that were just so frustrated with the system.
Yeah.
That I was like, man, I wish all of you could just band together and, do something really cool with this. My wife is a nurse, and, I was like, there's just so many great people out there that truly want the best for their patients that's just fed up with the system. So I kind of shared, I think the first time we met, my thoughts with you on that. And so I think it was a mixture of, there was a financial incentive to switch. But also I felt like it really just kind of matched our personality, and, we do want the best care for our employees, and, having that direct primary care is a big piece of that.
Right. So, you mentioned the savings, right? So when you talk about, that you're able to find discounts, that's exactly what you're doing is you're finding the cash price you're paying exactly what should be paid. We were talking about a hospital system the other day, and they like to charge 800 to 900% over Medicare, right? And so now we have contracts in kind of the 180 to 230% range, and so like that's that 700% difference there is like what gets eaten up by the company, right? Because it's your premiums and it's your I just saw another one. It's like the health plan got charged $30,000, but then they like actually ran it through the insurance and they marked it up to $60,000. Like, oh, that's our contract. And so it's like, so it's happening over and over and over and over.
Well, I think to break this down a little bit, just so, any of our listeners can kind of understand. So Kevin's kind of been through this for a little while. So I just kind of want to back up a step and just kind of share, kind of how this works. So let's just use an example of a CT scan. So if you need to go to your local hospital and you are going to have a CT scan, well, they know exactly how much that cost is for them. So let's say it's $300. Well, what they do then is they mark it up, again, that 800%. So I'm not going to do the math on that, but let's say it's around, $2,500. And so they have that huge markup on there. And at that markup rate, they will come to the insurance company and say, oh, here's our price, an insurance company. Then this is the bill that you get as the recipients of that, big insurance plan. You'll see on there, oh, thank goodness that we have Anthem. It only cost us $1,800, right? And so you're going, oh, whoo, good thing. They saved us $700. And what we see on the other side of that is we will then go to that hospital and we will say to the hospital, and this is what these plans are doing, these non-traditional plans. We go to that hospital and we say, we want to give you a fair rate for what you're doing. We don't want to have, these bills laying out there for you for months and months. We will pay you if you give us a fair rate. So then we come back and they say, okay, well, the price is $600. So now we've gone from it's $300. They make their profit there. We pay them $600, but we're very happy with that because now we've saved that company. And then again, that individual, because that individual probably hasn't met their deductible yet. So now we've saved that individual $1,200, and then we've saved the company also, and their insurance plan. So it's a really, really cool system, but that kind of hopefully it will help you to understand, kind of what we're talking about on the back end of these things.
Yeah, so what was that? Because obviously, I'm just guessing because I'm we're business owners too, but like wanting or trying to learn all of that is just like mind blowing, right? Like you're in business to win and to go out and sell and write and grow, right? So it's like this little thing over here, like we were talking about that the other day with like liability insurance. I'm like, I get it. This is why people don't want to talk about health insurance because it's confusing and frustrating and overwhelming, So what was that like kind of crossing that bridge and like, okay, we have to do something different?
Yeah. Again, I feel like it probably helped that I'd never had that experience with, like some of the really big providers where it's just like, this is just the way it is. This is how it works. I think that helps.
You did in the sense of like you kept getting renewal rates, and I don't remember what your rates looked like or anything, but
right, but me personally, never being wrapped up in that system of this is just how it works and just go with it.
Yes. Yeah.
I think one of the things that definitely helped, I have to give credit to Andrea, our HR manager, because she's worked with the health insurance before and is kind of like the explain it to me like I'm five situation, so that certainly helped. She definitely had more experience with it than I did. But it's just that constant pursuit for something better. And when you can get better health care that has the direct primary care at a better cost, it's a no-brainer.
But I think you bring up a great point because what you just said is so vital to every business owner. You do need them being, if it's your HR person, your broker, explain it to me like I'm five. Because usually the reason that they do it, they overinflate and they just like wash it by you. So it's like, oh, well, you wouldn't really understand this anyway. It's too complicated. And so then that's kind of what we have in our brains. Oh, well, as a business owner, I just have to take this renewal because
Just sign
yeah,
it.
it's
That's
just
all.
yeah, just sign
Yeah.
it. Like it's just it's too high level. And you're like, can you just explain this to me like I'm 5? They ought to be able to do that. Your broker ought to be able to, your insurance company ought to be able to, all of the cogs in the wheel, just explain this to me. And so I love that perspective. I think that's something that's really important for business owners too. It's like how we regain ownership of this cost that just feels overwhelming to us.
Yeah. And to that point, I think with every business, there are really big segments of your business that have nothing to do with your core competencies. So we all share that. It's having a good attorney, a good CPA, a good lender,
Liability
bank.
insurance.
Liability insurance is a big one. Healthcare, all this stuff. And I think for me and for me personally, I place a huge emphasis on working with people that I absolutely trust to have that conversation, to tell me, point me in the right direction. So especially with those, I'm not a CPA, and I know I'm not a CPA, and I know I'm not an attorney. So I need somebody more than anything that I can trust to give us the right guidance. And same with the liability insurance and all of that. So for me, I think especially with those sectors of our business, I place more emphasis on partnership than simply being a provider,
We'll speak more to that because I think what we have currently is the same thing. And for good reason, you cannot wear every hat. You can't touch everything, right? So you have to find, that's exactly right. What we hear mostly is that then, well, I have a good broker for that, or they handle that for me, right? And so for so many people, they're not hearing, all of this background noise of like what's going on in big insurance and everything behind the scenes. So what's your advice to those business owners that are used to just passing that off and that, they don't know that there's another option, or that they, certainly they would tell me, right? I mean, that's usually what we hear. Well, they haven't, I've never heard of this before. Why aren't they telling me this?
Yeah. I would say just the biggest thing is kind of doing your own research, and even with the research, it seems like you got to take that with a grain of salt. I don't know.
Right.
Just getting different perspectives, and like I said, the biggest thing for me is finding somebody to partner with that, okay, I can trust you to go out and find out what's best for, our company and give me that good guidance.
Yeah.
One, I think too, just a big part of this as a business owner is that if it's something that's your number 2 cost and it continues to go up and up and up and up, it's like, this is why we're telling you to take a good look at this. If our number 1 cost is, the salaries and, all of our employees, that's great. But if our number 2 cost continues to go up, why wouldn't we take a look at this? And this is what we're trying to have people do, is kind of start to peel those layers of the onion off. Like, just start to question, just start to ask, like, what are the other things that you could be doing? So I love what you're saying. You have so many great points, especially about, finding people that you can trust that can show you multiple avenues. What we hear so often is that folks will say, well, I really love my broker because my broker, they came to us with a 15% renewal, and we said, no, that's not good enough. We need you to find something better. So then they came back and said, well, actually, I got it down to 7. And aren't they great? And it's like, well, wait a second. Let's think through that. How did that process just happen? Like, what just happened? And have them explain it to you. Like you're a 5-year-old, like, walk me through this. What just happened there?
Where did all that cost just go?
Yes, right.
magically?
Yeah, yeah.
And why didn't you approach me with that the first time?
Exactly. Right.
Exactly.
Yeah. Yep.
Exactly.
I mean, it's just, as business owners, we all have to be thinking that way. And so I think you're really right to kind of be thinking a little bit different again about your number 2 cost.
Right. And I think especially looking at the consistency of the increase, everything is going up, but the rate at which healthcare is increasing every single year, it's like double digits, isn't it? Like every single year.
Exactly.
I don't know. I just feel like at a certain point you have to look around and just say that it's out of place versus everything else.
So let's look at what ended up happening then, because you guys were a regional finalist for your health plan, and how well it's gone, how well it's been doing. This was the Health Rosetta Awards, and so that was really exciting. So kudos to you guys. I think I was kind of checking back again. that it was something like, $1,300 in savings per employee, right? Is what it kind of added up for you guys. So that's significant.
Sure.
But then now they have a zero deductible plan, right? And that, like, I always have to just say that again, like zero, like no,
right.
like we talk about having kids or surgery or whatever. And it's exactly like you said, where did all that cost go? Well, now it's not being passed off to the employee, right? And so it's built into the plan that it works just how it should. And, so premiums go down and deductibles go down, right? So,
So we always like to explain it to people too, because it does sound too good to be true. So we love having, business owners kind of just explain that to us too. So you guys are actually seeing the results. What part of this has been, your favorite part, I guess, too, even just as an employer? Like, what are you hearing? And,
I think we've gotten some really good feedback about our plan. It was nice to hear some positive things about a healthcare plan. That was pretty new to us. And, I'm not just saying this because I'm on your podcast, but I've gotten a lot of good feedback about Victress, about that being the first time that they've had that type of direct primary care. Or, I've had, folks tell me that they've had their family doctor for the last 20 years and they've had this recurring issue and they feel like it's actually getting addressed. They've said that they feel like they're absolutely heard and there's no rush and, all these great things. So I feel like, part of the reward, we definitely like the cost savings, which, by the way, for us, I think we're probably spending the same, but we absolutely have covered more individuals. You know what I mean?
Right.
It's a better rate, but
once they find out how good it is,
right? Which is also a good thing. We're able to take care of more individuals. But I think that our associates are happy with the plan and they're happy with all the care that they're getting.
Right. I think that's a good point to bring up because we've heard that before. We'll have, we can't, what would happen if we have 25% more people come on our plan because it's so good? Like we can't, budget for that, but it's like, okay, let's think again, then this is why we kind of really speak to the visionaries, right? Of like, well, 5 years down the road, you're already going to be spending that much anyway, with this price increase, number one. Number two, now you're going to be funding these people that are also sicker because they didn't get the care that they need, right? So it's like, okay, even if we have all these people jump onto the plan because it's so nice, so it's such a good plan, okay, that increases our budget momentarily, right? But we would have already been looking at that kind of cost increase down the road anyway. So now, like you said, we're covering more lives, even though our cost didn't go up, right? I mean, is that?
Yep, absolutely.
Yeah. Well, I really appreciate you coming in and sharing your perspective. Is there anything else that you would like to share or say about the process?
I don't think so. I think we covered a lot of it, unless you guys have anything else.
Yeah, I mean, I think you really nailed it. The one concern that we hear over and over from business owners is their employees saying to them, oh, but I could never leave Dr. So-and-so. And so it is really helpful to hear from the employees too. Like, I was with them for 20 years, but now I'm finally getting some things addressed that, maybe hadn't been. So I really appreciate that. And thanks so much for joining us today.
Absolutely.
Yeah,
thanks for having me.
All right, we'll definitely have the link to Buckeye Electrical Products website downstairs or below in the comments down there. And we'll also have links that you can get in touch with us, ask any questions. So thanks so much.
Absolutely.
All right.